Greetings from Spain. Thank you very much for watching this presentation about male readjustable sling effectiveness in male patients with stress urinary incontinence. I have no affiliation to disclose regarding this presentation. When conservative management fails, male patients with urinary stress urinary incontinence are considered for surgical treatment. Simple, more economical and less invasive surgical techniques such as the male readjustable sling have been developed. The aims of the study are to analyze the objective effectiveness, the need for the adjustment, the survival and complication rates of the male REMS system tool in the treatment of male stress urinary incontinence. A prospective observational study was developed including 47 men with urinary incontinence after prostatic surgery and/or radiotherapy who received a MRS device between July 2015 and May 2020. These patients were divided in 3 groups according to incontinence severity. Before surgery, measured in number of pads used. Group A were those patients with mild incontinence, 1 or 2 pads per day. Group B, moderate incontinence, used 3 or 4 pads per day, and patients that used more than 5 pads per day were considered Group C. The effectiveness of the device was assessed by the number of patients achieving complete or partial continence. The mean age was 69 years old, with a range between 58 and 80 years. Mean follow-up was 33 months. First graph showed the previous procedures undergone by the patients, which caused the urinary incontinence. 29 radiotherapy, 65 open radical prostatectomy, 25 laparoscopic radical prostatectomy, 8% transurethral resection of prostate. Nearly 1 in 4 patients of the sample have had a previous anti-incontinence surgical treatment, 19.15 advanced and 4% atoms. Objective effectiveness was observed in 89% of patients, 85 in Group A, 90% in Group B, and 88 in Group C. There were no significant difference among groups. 29% of patients in the sample that received pelvic radiotherapy, they have had an 85% of objective effectiveness, which was significantly lower than the 90% in non-radiated patients. 34% of patients with an implant required at least 1 adjustment, without significant difference among groups. 1 readjustment was needed in 17% of patients, 2 readjustments in 14% of patients, and 3 readjustments in 1 patient, representing 2% of the sample. Group C was the group with the highest readjustment rate, with 44%, as opposite to 42% in Group A and 22% in Group B. We also analyzed the survival of the device, and 95% of the implants remained in place at the end of the follow-up. Only 17% of the patients suffered complication. Bladder perforation during the insertion of the retropubic needles occurred in 5 patients, 10%. In this case, the needles were withdrawn and reinserted to finalize the implantation of the device. Postoperative complication occurred in 3 patients, 6%. 1 patient in Group B reported perineal pain. A patient in Group A required removal of the device from the system due to infection. A patient in Group B with a history of radical prostatectomy following radiotherapy developed urinary retention. In this patient, bilateral vesicoureteral reflux was identified that could not be attributed to the to the remis device, but the device were removed. In our study, we can find that the rate of the completely dry patient, 72%, is higher than the rate reported in previous studies, 36 to 64. Also, a lower percentage of patients who receive one or poor readjustments, 34% in our study, was found in comparison to previous studies, where the rate varied between 60% and 91%. A tendency towards less need of postoperative readjustments has already been reported and has been thought to be caused of device improvement, but also the standardization of the technique and the postoperative regulation may play a role. In conclusion, the male readjustment sling is an effective and safe method for the correction of the male urinary incontinence regardless of the severity of the incontinence, and it has a high survival rate, a few postoperative complications. 1/3 of cases will require system readjustment. Thank you very much for your attention.